Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 6th of October. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great, thank you very much.
In the United States yesterday, we actually saw 80,000 positive new cases. Fortunately, our 7-day average is around 43,000 positive new cases. We're seeing a 23% decrease of cases over the last 7 days, but yesterday we had a pretty big spike. Hospitalizations have decreased by 11%, and the death rate in the United States has also decreased by 8%. In Illinois, yesterday we saw roughly 1,848 new cases, with our 7-day average being at about 1,500 cases per day. There's a 29% decrease over the last 7 days of cases, and hospitalization and deaths are decreasing by exponential numbers in Illinois, which is awesome. Okay, there is this prediction going on in the news that we're going to hit this massive peak in November, a huge spike. Is this the 7th wave that we're going to see? Is this a myth? What do you think, Dr. Murphy, looking at these numbers?
Well, I think I don't know, but what we do know is that the case numbers are going down globally. So this big global wave is coming down at different rates and whatever. There's some blip ups in South Africa. I know they had some blips, but here it is really going down. It's going down in Asia now. Most of the Asian countries have just recently, as of October 1st, finally loosened their travel restrictions. So like in Thailand and other places where a lot of tourists go and stuff, it was very difficult to go there really until this weekend, until October 1st. So that's good news. The spike that you report on is really an anomaly about the reporting now, because the places are not reporting as robustly as they usually did. They're batching things, and the numbers are coming in much more sporadically. And so that's why we have to look at averages, over a 7-day period, because the daily rates aren't as dependable anymore. But however you look at it, the numbers are going down. What is not improving is the new vaccine, the new bivalent vaccine booster. The uptake is very low so far. This is a little disturbing because that gives you protection against the Omicron variants. Remember, the original one is against the original virus. And the immunity to that is long gone. So, I mean, you have some cellular immunity effect. It's still better that you had it than don't have it. But, I mean, you're going to need an updated vaccine. You are going to need an updated vaccine. And you might as well take it now, 2-3 months after you've had COVID, 4 to 6 months after you've had your last booster. If you're eligible for boosters, just go out, and everyone is eligible now pretty much. Go out and you can get it. As far as this prediction about what's going to happen in November, who knows what's going to happen. But make sure you also get protected against flu. Flu is very similar. The immunity does not last. You always have some immunity, but you don't have a lot. And that's why you get an annual booster shot. You can take the vaccines together, although I'm not, on a clinical level, I'm not recommending it. I mean, if it's for convenience, go ahead and do it. But I think you'll have fewer side effects from the vaccine, which is the typical aches and pains, maybe even a little fever for a day or two. But if you can split those up if you want. You can take them together if you want, but I am splitting them up because some people have a pretty robust reaction to the vaccines, both either flu or COVID. So, you don't have to take them together. So take them apart if you want. And that will keep everything going in the right direction. So we'll see if there's another spike. there's more variants coming down the road. Right now, all the ones that have been identified are still related to Omicron. But if they jump out of the Omicron category, then, I don't know, we may see bigger problems.
Exactly. Well, our next and big headline of the day is super interesting. It ties well into this, which is this split dosing of COVID-19 vaccines provide antibody responses. Okay, so what can you tell us about what is split dosing and how is it benefiting people who might have had allergic reactions to previous doses, etc.?
Well, what happened was the investigators took people who had a bad reaction to the original vaccine, called allergic reactions, but certainly not anaphylaxis, where you get shocky and stuff like that. But some people had some bad reactions to the vaccine. No big surprise, since many billions of doses have been given. But anyhow, they took these people and they split the next vaccine dosage. So they took like half at a time. And basically what they're saying is, if you've had a bad reaction before, you can split the dose and you'll have the same immunologic response. In other words, it'll work just as good if you split that dose. So it's just another option that people have. If they had a bad reaction in the past, they can split the dose. They have to take 2 doses, but you can split them.
Wonderful. Well, our next headline is about long COVID. So science has learned a lot more about the sense of loss of taste and smell. Okay, so what can you tell us about long COVID with loss of taste and smell?
Mm-hmm. Yeah, long COVID has been noted very early on, and one of the worst side effects of long COVID is this loss of smell and taste. It's very disturbing to the people that have it. It's pretty rare. It's less than 5% of the long COVID patients, but there's ways to address it. And it can be kind of a behavioral learning process. You have to learn how to smell again and coordinate and make relationships with the smell. There's all sorts of things that you can do. But it's a difficult problem. Now, they're learning more about it, and the cells that are associated with smell are called sustenticular cells, and fortunately, they turn over time and every couple months, and so a lot of people that have this problem kind of over time get over it. But you may have to teach your brain how to smell again to make the right associations with it. So it's an unfortunate side effect. It can be treated in certain ways, and it is likely to go away.
That's wonderful. And now for our last big headline, Dr. Murphy, I feel like you and I preach the new booster all the time, but apparently half of adults in the United States have actually no idea about this new booster. So what can you tell us about this lack of information that's being spread, or not information being spread at all?
Well, there's not a lack of information. There's like a plethora of information. There's a lot of information, but people are not getting it. It's not getting to the population. And there's a couple of reasons for that. One is a lot of people think COVID's over. I did my booster or whatever. I did whatever I did. And so they're not really tuned in to hearing about, do I need another booster shot? And that this booster shot is very different from all the other booster shots you've had. So first you get vaccinated, whatever type of vaccine it is. It can be, the old J&J, the Novavax, Moderna, Pfizer. And then you're supposed to get a booster that really helps. This is just like every other vaccine that you take. And then we recommended a second booster. Less than a third of people took that. And now we're saying take another booster, but this booster is actually different. This is designed differently for the Omicron virus, the current virus that's circulating. And the messaging is terrible. Let's just say it could be better. And I think everybody understands this now. So Rochelle Walensky, Dr. Rochelle Walensky, who's head of the CDC, commissioned an independent commission to study what's going on with the CDC, what happened with COVID and whatever. It was a very, let's see, critical report. And this is nothing new to the CDC. They do their job, but they have not really been the face in the public with any kind of epidemic, whether it was anthrax or whatever, Ebola. And we have to remember that the entire structure in the United States for public health is led by the states and large cities. Like in Illinois, we have the Illinois Department of Public Health, and we have the Chicago Department of Public Health, and we have the Cook County Department. We have all these public, but within Illinois, 12 million people, 12.8, I guess. Anyway, so that doesn't work with all the free flow of people and communication and products between the states. That it just it doesn't work to have the states run it, because you've got then all the states, all the big cities, all the territories, Washington, D.C., Puerto Rico, Guam, other territories of the United States. You get everybody kind of doing their own thing. So the structure is very poor. Well, it's not poor. It's just the way it is. It's just not optimal. Some states do it good. Some states do it badly. Anyway, so that's one part of it. But the second part of it is that the actual messaging, translating and implementing the science that is driving the major decisions is fragmented, not streamlined, and unclear. That has to be fixed. And is this a tweaking? This is not a tweaking. This calls for a redesign. It's not clear. It's not clear in this report about the redesign, what it is, but it is a redesign, and that's what really needs to be done.
No, entirely. You're exactly right. Now, for our only in one COVID question, this individual says, I just received my COVID bivalent booster and want to know if you think that boosters will be annual or more frequent. Dr. Murphy, what do you think about this?
I think that most likely, with all the immunity that's out there from all the past infection and all the vaccines that have been given and the new vaccine and everything, that most likely it's going to be an annual type thing. That's what it looks like it's going for. Now, the one thing against that is that COVID is not a seasonal infection. We could have spikes in the summertime or at any time of the year. It really doesn't make any difference. Whereas flu really always starts in late fall and goes to winter. But it looks like it's going to be, it will likely be annual.
Wonderful. Well, those were all of our COVID questions for today. Thank you so much, Dr. Murphy. We will see you next Wednesday.
All right. Thank you.